Them when we're going to undergo surgery. Anesthesiologists make sure we don't feel a thing under the knife. But when you search job openings in the Tucson area, you see dozens of open positions.
It seems that there's likely a little bit of a shortage. I think nationally there's somewhat of a shortage of anesthesia providers, whether at the physician level or the CRNA level. Part of it is just the nature of our medical training.
Dr. Jeremy Chastain is an assistant professor in a clinical track at the University of Arizona's Department of Anesthesiology. He says there are a limited number of trainees of the practice each year.
Because of that, that limits how many trainees are certified as anesthesiologists each year. The overall number of surgeries continues to increase, but the number of trainees accepted into these residency programs isn't really increasing. And so that kind of makes a shortage.
But he explains it's still a hands-on learning experience for medical students. The trend medical providers have seen over the past 8 months is a drop in surgeries under the executive orders and then an uptick once elective surgeries were able to begin again.
Part of the problem with that kind of hiatus that we took a little bit there in the early period of the COVID pandemic was now causing a backlog in some of the cases. So in a way, we actually have more work to do than we did before.
Anesthesiologists do more than what meets the eye. In fact, their field has several subspecialties, such as childbirth and delivery, pain management, and even ICU care, a subspecialty that's been used during the pandemic.
Say the patient needs someone a little closer eye on them for that next day or two.
Dr. Chastain says although some can feel like they're being spread thin, one of the nice things about their practice is once they're done with their tasks for the day, they can unplug. Sierra Encinas, KGUN 9 on your side.